Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome to Understanding the Human Condition with your host, Dr. James Flowers.
Hey, Robin.
Hey, you.
How are you?
I'm good. How are you?
I'm super excited today about our topic.
Yes.
Yep, and our guest. You want to introduce?
Yes, we have John Huckaby from the AIDS Foundation of Houston. Welcome.
Thank you. It's good to be here.
Thank you for joining
me.
us. Yeah. I have a little bio I wanted to read, and then we can get started with some good conversation.
Sure.
Okay, great. John Huckaby is a Chief Executive Officer of AIDS Foundation Houston. He was first introduced to the AIDS Foundation Houston in 1991, where he began his nonprofit career as a case manager when the agency was less than 10 years old. He has served in various capacities, including case manager, director of client services, director of volunteer services, and chief planning officer. He returned to the AIDS Foundation Houston to serve in his current role in May of 2019. Welcome.
Thank you.
Welcome.
Thank you so much for being here. You know, when I first read that, I was thinking, gosh, he's been there since 1991, but you actually haven't been there since 1991. You kind of worked as a case manager and then went on to do other things and then came back.
That's right.
But you've certainly served in a broad role. That's very cool. Gosh, we were just talking before the podcast 30 years ago, right? And how things have changed in the HIV world, or the world of HIV.
Yeah.
And I was talking to our good friend, Dr. Shannon Schrader, earlier today about doing this. And he was so excited that we were doing this together today and talking about the changes as a physician that he's seen, right? You know, Dr. Schrader started out as an HIV and AIDS physician, seeing patients in the hospital every day, you know, and patients dying every day. And now his practice is virtually internal medicine practice for the general population because there's no, it's not like it was, I'll say.
Right.
Yeah, pretty amazing.
How things have changed.
Yeah. Tell us about AIDS Foundation Houston. It's certainly a cause passionate in my life, and I'm very familiar with AIDS Foundation Houston, but I want our audience to know from you. Tell us about AFH.
Right. Yeah. So we were founded in 1982. So as you know, that's about 1 year after the first diagnoses here in the United States. And really, we came to be because a group of Houstonians were passionate about something has to be done, right? We weren't seeing the effort on the federal level to really push out resources and information around this new unexplained virus that was affecting so many in our communities. And so they got together, and it was their passion that gave birth to AIDS Foundation Houston. We've been operating ever since. We're in our 40th year, and it's all about information, education, resources, reaching out to those who are vulnerable, and making sure that they have equitable access to care.
Yeah, absolutely. How did your passion for AIDS Foundation Houston and working in this environment, tell me about that. You and I were talking a little bit before the podcast of what life was like in the 80s for us, but go ahead and tell me a story about your passion and how you got to where you are today here.
Yes, as a young 20-something growing up in the 1980s and really coming of age just as we were learning about HIV, and the terror, the fear that we all experienced at that time, and knowing people in my life, friends, people who are close to my family, diagnosed with HIV, and seeing the trajectory of the disease in their lives and watching them die had such a profound effect on me personally. And I remember the night that someone very close to our family died. I was with his partner that night, all night long, and just seeing firsthand the devastation that HIV had brought to that family unit. And I remember waking up the next day and thinking, I need to do something. I need to get involved in this fight.
Yeah.
And that's what gave birth to many, many years now of working in the field and working alongside so many allies and advocates and activists who have been so critical in moving the needle.
Yeah. Well, it's amazing work that you do. And it's even more amazing for me to read something that you want to talk about, that is, and what does it mean to end the HIV epidemic, and how is that possible?
That's
because,
right.
Again, years ago, we would have thought that's not even possible, but it is now.
You know, we used to sign all of our letters until it's over, right? Back in the 90s, we used to sign our letters until it's over. It was an aspiration. It was something that we hoped for. Our mission is to end the HIV epidemic in the Houston area. Well, you know, what does that mean? So are we talking about eliminating HIV altogether? Well, hopefully one day, yes. But we can end the epidemic even without ending the presence of HIV, right? And we have this very current example that we're living through right now with COVID. Basically, what this means is you start from a baseline in 2019. We have about 1,200 new confirmed cases each year in the Houston area. You start with that baseline and you reduce that by 90%. That's the goal by 2030, is to reduce that by 90%. When you take the viral burden in a community and you reduce it so much, you are able to finally do your contact tracing and your containment so that you're actually not having uncontrolled community spread. That would be an indicator of ending the epidemic.
It's amazing. Now, you said 1,200 new cases a year?
Just here in Houston?
Just here in the Houston area. That's correct.
I actually thought that I said that because I thought you were going to say much higher than that, but it's still a lot, right?
Well, obviously, yes, it's come down. So here's sort of the historical perspective on that. I mean, we used to have thousands and thousands of cases each year, confirmed cases.
Many.
We've come down. We've plateaued at about 1,200 new cases confirmed each year, but the challenge is it's plateaued. We're not seeing that continue to decline. And so that mirrors the national trend where we have about 38,000 new confirmed cases each year.
Something new in our lives is PrEP, right? And I don't even know how old PrEP is now, but it's newer in our lives. And I was wondering if PrEP could be one of the reasons that we're plateauing at 1,200, or is that helping it keep it at 1,200, or will it help it go down? And what your thoughts on PrEP are.
Right. So we are in a situation where we have neither a vaccine nor a cure, right? And so obviously, if you want to wipe out HIV, you want one or both of those, right? In the absence of a vaccine, we do have a pill that is available to be taken once a day, and it is up to 99% effective in preventing the acquisition of HIV. So when you think about COVID, for example, and the approved vaccines that we have now, you're talking about 90-95% efficacy rates. This is a hugely efficacious and safe once-a-day medication that can prevent HIV. So what's the challenge? The challenge is that, well, first of all, taking a pill every day is a challenge for some folks, right? But also uptake. So it's a matter of getting the word out into the community, making sure that everybody, especially those most vulnerable, have access to this medication, and that it's affordable, and that they can tolerate it. So there are lots of reasons why someone may not access it or someone may not adhere to PrEP. If you look at the CDC modeling with regard to who would be indicated for PrEP in a given community, and then you look at the number of people actually taking PrEP, it's a small fraction.
Okay.
So PrEP has the potential to be a real game changer. The key is access and uptake.
Yeah, absolutely. Do you think that PrEP has had an adverse reaction in the form of increased number of STIs?
It can. We prescribe PrEP at AIDS Foundation Houston. We provide it at no cost, regardless of a person's insurance status. For us, it's a justice issue that we want to make sure those most vulnerable have access. And as part of our education around PrEP, we always remind people this is not a protection against pregnancy. It is not a protection against other sexually transmitted infections. And so when we test for HIV, we also test for other STIs so that if there is the presence of an STI, we can treat it.
Right.
And what we know about the common STIs, chlamydia, gonorrhea, syphilis, is that we're talking about the co-occurrence of an STI is correlative with a greater risk of acquiring HIV.
Right.
So we want to make sure that people are properly informed and so that they can take additional precautions to protect themselves and their loved ones.
Absolutely. You know, from the numbers that I read, it seems like, and correct me if I'm wrong, more than 50% of the new cases of HIV these days are for people that are older than 50 years old. Do you know anything about that statistic?
Well, what we're seeing, the statistic that I have been most alarmed by is that the fastest growing group of new confirmed cases are among people ages 13 to 24.
Got it.
Oh,
Okay.
wow.
And so you've got many people over 50 living with HIV, living longer, thank goodness, with HIV, complete normal lifespans today.
Yeah.
But you have this group of young folks that were not raised in the time that you and I were raised. They didn't see what we saw.
Right.
And so they don't have that historical memory that creates that urgency for them for self-care and prevention. So that's one of the challenges we're seeing is these are not perinatal infections. These are infections acquired during their teen years and early 20s.
Got it. That's so interesting. You know, and speaking of what we saw, you know, looking back historically, and that was in the 80s, having not one friend die a week, but multiple friends die, sometimes
Tragedy
a day,
after
but a week.
tragedy, yeah.
And it's so amazing to see that progress and where we've come in the treatment. Where does AIDS Foundation Houston fall when looking at the disparities of HIV today and lower economic status individuals such as Hispanic and African Americans in the South?
Yes.
What are you guys doing to address that?
Yeah, so the CDC estimates that over half of all new infections in the country today are happening in 50 cities, right?
Wow.
And Houston is one of those 50 cities. And so they are really beginning to target resources in these areas, right? The Health Resources and Services Administration just released a study. They've been doing a longitudinal study of viral suppression rates from 2010 to 2019 among those enrolled in their program, right? So this is a good 10-year look back on viral suppression rates. And what we're talking about with viral suppression is a patient is virally suppressed when the amount of HIV in the bloodstream is so low that it's not detectable on a standard viral load test, right? So fewer than 200 copies per milliliter of blood. And so viral suppression is a really important indicator of the efficacy of treatment, adherence to treatment, access to treatment. Where do you see viral suppression rates the lowest, right? You see viral suppression rates the lowest, and it's the same here in Houston. Persons of color, young people, people in the transgender communities, and people with housing instability, right? So the medications are there, all the access is theoretically available, and yet when you look at viral suppression rates, you see the effects of the social determinants of health impacting health outcomes.
What do you think some of those social determinants are? What do you impacting health?
Right. So one is stigma. So we talk about, for example, when we talk about HIV stigma, we're talking about those negative attitudes and beliefs about people living with HIV. And I've heard this, you've heard this. This sounds like, for example, well, if that person is living with HIV, they must somehow deserve it because of their lifestyle.
Right.
We've all heard those messages. Or why do you need to have an HIV test? You know, that sort of that implication that, well, what are you doing that you need to have an HIV test? All of these negative perceptions and attitudes can be internalized by people, and that creates the fear and the shame that keeps them from accessing care.
Absolutely.
Right?
Yeah.
These can come from religious institutions, they can come from cultural norming, they can come from politicians and policies. And so all of these things can perpetuate these stereotypes, these biases as a result of stereotypes that inform stigma. And so if you are experiencing stigma, you're less likely then to say to your physician, hey, how about an HIV test?
That's right. Absolutely. I was going to say, in fact, not only from religious leaders, but it also comes from your own physician sometime, right?
That's
your
right.
Nurse, your healthcare provider. Yeah, which is amazing. Robin, I think you wanted to, I keep interrupting, so I'm going to let you.
I wanted to go back.
Yeah.
You two kept referring to PrEP.
Yeah.
And so explain to the audience what you mean by PrEP.
Yes.
Because you were assuming that everyone knew what that was.
Right.
But not everybody does.
And we throw that around so
including
much,
me.
and it's so important.
So for those folks listening who didn't know what you were referring to.
Yes, so PrEP is pre-exposure prophylaxis, or short PrEP, right?
Okay.
And PrEP is a once-a-day pill that can be taken by an individual who may feel they're vulnerable to acquiring HIV, so that as they take this pill once a day and they build it up in their system over several weeks, they are up to 99% protected from acquiring HIV, right? Even through condomless sex, for example, right? So this is a huge game changer, which has come around in the last 5, 6, 7 years.
That was my next question. Yeah. When did this come about?
And the two drugs that are available or approved by the FDA for PrEP now are Truvada for men and women, and Descovy for cisgender men and trans women. So these are huge resources that we didn't have 25, 30 years ago, right, when we were talking about prevention. And the caveat of that is that PrEP, while it's very, very good at preventing HIV, it does not offer protection from other sexually transmitted infections. And so it's important to have the entire health conversation with the individual who's considering PrEP.
And so is this something covered by insurance typically, or no?
Yes, it is. There is both the brand name Truvada and the generic Truvada that have come to market. And then there's Descovy, only under the brand name. And Descovy has not yet been approved for cisgender women. So for cisgender women, we're talking about Truvada only as their option. Descovy is considered to have fewer potential side effects. And so trials are underway now in cisgender women for Descovy, so that hopefully that will become available to them. Insurance generally covers this with no cost sharing on the part of the patient. If the patient is uninsured, then the drug maker has a patient assistance program to help make sure that they pay no out-of-pocket costs. One of the things we do is we ensure that all patients who need PrEP can access it with no cost sharing.
That's awesome.
And it's saving hundreds and hundreds of thousands of lives, or at least the diagnosis of HIV, right? Preventing the diagnosis of HIV on hundreds and hundreds of thousands of people. So prior to 5 to 7 years ago, there was no real protection. So.
And the medications, so for someone who has HIV, have come a long way now too. For those who do have it, keeping them alive.
This is really exciting news. Again, when I started case management in 1991, we had AZT. This was the one drug that was available. And it had some limited, prolonging of what was then the inevitable. It was a very straight line trajectory of HIV disease toward AIDS. Today, it's, we're so grateful because HIV is no longer that one line trajectory, right? We don't even actually use the word AIDS because a person can come to us, maybe they've never been tested. And a great percentage of people who come for testing actually diagnosed with a clinical diagnosis of AIDS because they've been living with HIV for so long, right? But because of the medications we have available today, what we call antiretroviral treatment, or ART, we can bring a patient back from that clinical diagnosis of AIDS. We can see great restoration of the immune response and the immune system as a whole, so that now we talk more about HIV or late stage HIV disease, right, if a person has progressed. But it's not linear any longer. They can come back from that and achieve what we call viral suppression. And viral suppression is a huge game changer for people living with HIV, which is why testing is so important.
Yeah. So that gets back to you working with the providers, and just educating them, and it really starts there, right? With all the...
It starts there. It starts in the prisons. We're in the prison system in Texas.
We want to talk about that.
We do community outreach campaigns. We do testing at all the local events where people gather. So a huge emphasis on testing, because 1 out of 7 people living with HIV today don't know they have HIV.
Oh, wow.
So if a person is living with HIV and they don't know it, a couple of things are happening. 1, they're not able to get the life-saving medications that can keep them safe and healthy.
Right.
And number 2, they're at risk of transferring HIV to others.
Are
So
the medications...
testing is important.
Are the medications less expensive now than they used to be? Because I remember back in the day, they always talked about how expensive the medications were to keep you alive.
They were expensive, and they were very hard to tolerate in terms of side effects, in terms of adherence, because you had multiple medications, some with food, some without food. And so it was quite a challenge just to adhere to the medications that were available. Some HIV care regimens today are single pill, once a day regimens. The single pill contains multiple medications. And so it's a completely different treatment plan today than it was years ago. So not only they're more tolerable, they are more affordable, and we do find that insurance is covering them. And for people without insurance, we have programs in place in the state of Texas to make sure that they can receive those medications without cost sharing.
That's
So really, anyone that wants to be on medication has the ability to be on medication.
Absolutely.
For
And
HIV
this is the
treatment.
great,
That's awesome.
Yeah.
and I appreciate you really putting an exclamation point on that, because this is the great misconception,
Yes.
is that, well, those medications are out there, but how can I ever get them?
Right.
Well, at AIDS Foundation Houston and with our partners, we're absolutely committed that you can have access to them. That's the
Yes.
whole point.
Absolutely.
Yeah.
Who funds you, John? Who funds the AIDS Foundation of Houston? Where does that come from?
Yeah, so our community. We're a community-based organization, and so our events like our annual Walk to End HIV is a huge part of that, our annual World AIDS Day luncheon that we hold. The community is a huge supporter of the work we do.
Okay.
We also receive funding from the federal government through the Center for Disease Control and Prevention in Atlanta. They fund much of our outreach and testing programs. The U.S. Department of Housing and Urban Development funds our supportive housing programs. And then we have corporations and private foundations that fund things like our prison initiative. So it's a whole multitude of resources coming together. It takes a community, and that's how we do it.
What's the budget now in 2021 of AIDS Foundation Houston? Because I am sure in the last 40 years it has drastically changed.
Yes. So, back when I started, we were a few $1 million agency, prior to the Ryan White Care Act coming about in 1991. This year we'll probably be at about $12 million in investments in the work that we do.
That's amazing.
Yeah.
That's fantastic. What is AIDS Foundation doing really in the community to address co-occurring mental health issues? About 40 to 75% of people with HIV have a co-occurring substance use disorder.
Absolutely.
What do you guys do to support that?
This is another one of those factors when you mentioned about why are we not seeing the numbers come down at a faster level, given that PrEP is so available. So persons, as we know, persons who are suffering with substance use disorder are suffering with mental health issues. Are going to have a more difficult time adhering, for example, to a daily regimen
Right.
of PrEP, for example, or of HIV treatment, for example. And so one of the things that we do is, first of all, we work very closely with the mental health providers in our community. Shout out to the Montrose Center. They've been doing this work since the 1970s, and they are wonderful at what they do,
Yeah.
right? And so we work very closely with the Montrose Center, with other providers. One of the things we do a lot of supportive housing, because we know that if someone is living with HIV and they don't have a place to live, the last thing on their mind perhaps is going to be getting an HIV test or getting into care. So one of the things that we've always done since 1982 is supportive housing for people living with HIV. But as part of that, it's not enough just to provide the key to your front door.
Right.
We know that if someone is suffering from mental health or substance use disorders, that we need to be able to provide them accessible, culturally humble, affordable care. And so we do that directly
Right.
at all of our housing programs.
It's fantastic.
Yeah, we provide those services to them.
That's great. Tell us real quick. I know we're running low
We
on
are.
time.
You saw me look up.
I saw Robin look up. Tell us about U equals U.
U equals U is an exciting resource. It's known as treatment as prevention, right? And so what U equals U is undetectable equals untransmittable.
Got it.
And a huge shout out to Dr. Bruce Richmond, who really studied the science around this and really got the World Health Organization and the CDC and other public health officials to really endorse it. So what this means is that a person who is living with HIV, who is on antiretroviral therapy consistently, and who, as a result of that treatment, is able to reduce the viral burden in the body to such a level that it is no longer detectable by a standard test, undetectable, means that they will not be able to transfer HIV to another person through sex.
Yeah.
This is, when we talk about stigma, we talk about shame, we talk about fear, we talk about helping people to have a positive view of human sexuality. For the person living with HIV to know that U equals U means that they can have that positive, healthy sexual life, and that they will not risk transferring HIV to someone they love. This is huge.
That's
This is
huge.
such a huge message.
Absolutely. That's amazing. Yeah.
I just wanted to put a little shout out to our LGBTQ chamber, which is the reason that we met,
Yes.
right? Especially
Yes.
Tammy Wallace, their president, who's spectacular.
She's phenomenal.
Which I hope she'll listen to this and hear her name. But I wanted to thank them for bringing us together. And
Absolutely.
Thank you for coming on.
Such an important resource in our community.
They really are.
I have one. They are one final. I wanted to ask you about support services like the food pantry.
Yes.
Do you want to talk just a little bit about AIDS Foundation Houston and the support services?
Yes, and everything can be found at our website
Yep.
at aidshelp.org. But yes, so food security programs through our Stone Soup Food Pantry, 6 supportive housing programs, each designed to serve vulnerable communities. For example, we have one who is dedicated to women and trans women. We have one housing program dedicated to families where one person is living with HIV. We have over 65 children living on that property right now. A summer camp for children living with HIV. Case management and benefits counseling services for persons in need, referrals for mental health and substance use disorder treatment. Because what we know is, while we are not a medical provider, we know that so much of what drives healthcare is what happens outside of the clinic. And so what we want to do is take that person who's coming out of incarceration, for example, providing those safety net services, and then linking them to care with culturally humble providers that can provide that care and give them a shot at living their best life.
I love that phrase, culturally humble providers.
Yeah.
That's fantastic. I, quite frankly, have not heard that.
Yeah, I
for
like it.
affirming and what have you, but I love the culturally humble phrase. So thank you. Thank you so much. Is there anything that we haven't talked about today that you would like to touch just in closing over the next minute or so?
Thank you. I just would like for the people of our community to know that if for any reason you are uncertain about approaching your physician, your primary health care provider, about HIV testing or STI testing or treatment, that we understand. We know the stigma that is still present in our communities. And what I want to say to you is come to AIDS Foundation Houston, because you will find a safe place. You will find those culturally humble providers who will provide to you the information you need, the HIV and STI testing you need, the PrEP care services that you may need, and we will do it in a way that is affirming and that is non-judgmental, and that gives you a place where you can have the equitable access to care that you need for yourself and your loved ones.
That's excellent. Thank you so much for being here today.
Thank you for having me. So appreciate it.
Thank you.
And thank
Great
you,
to
Robin.
meet you. And if they want to reach you by phone, I know you gave us the website.
Yes.
What number should they call you?
You can call our main number at 713
Okay.
623 6796.
And the website again is?
AIDShelp.org.
Perfect. And Dr. Flowers, if they want to reach you at the J. Flowers Health Institute?
jflowershealth.com.
Perfect.
Thanks,
Thank you,
Robin.
gentlemen. All right.
Thank you.
Bye.
All right.